Hey everyone! Today I've got some big news from the world of politics that's sure to get people talking. President-elect Donald Trump has just announced his pick to head the Centers for Medicare and Medicaid Services, and guess who it is? It's none other than Dr. Mehmet Oz. Yeah, you heard that right. Dr. Oz, the famous TV personality and health guru, is taking on one of the most significant roles in the U.S. healthcare system. So let's dive into why this nomination is a huge deal and what it could mean for millions of Americans. First off, let's talk about the CMS. This agency oversees Medicare and Medicaid, providing health insurance to over 150 million people. It manages a quarter of all federal spending. So yeah, it's a pretty big deal. The decisions made by CMS can affect everything from the cost of your prescription drugs to the availability of healthcare services in your area. Now, Dr. Oz stepping into this role has definitely raised some eyebrows. His background is in medicine and television, not government or healthcare policy. Remember, this is the same Dr. Oz who ran for Senate in Pennsylvania back in 2022 and lost to John Fetterman. So what's the deal with Trump picking him for such a critical position? Trump's statement highlighted Dr. Oz's 9 Daytime Emmy Awards and his impact in educating millions of Americans about healthier lifestyles. Trump seems to believe that Dr. Oz's media savvy and health advocacy make him a good fit for the job. But will his skills on TV translate to managing a massive federal agency? That's the big question everyone's asking. There's also talk about Dr. Oz working closely with Robert F. Kennedy Jr., another unconventional choice, to tackle what Trump calls the illness industrial complex. This suggests a possible shift towards preventative care and lifestyle changes in healthcare policy. But implementing these ideas within the complex framework of Medicare and Medicaid might be easier said than done. Critics are already voicing concerns. They argue that Dr. Oz's lack of experience in government and healthcare policy could be a major hurdle. Leading an agency as vast and influential as CMS is no small feat, and it requires a deep understanding of both healthcare systems and bureaucratic processes. On the flip side, supporters believe that his fresh perspective and media prowess could bring innovative changes to the agency. They argue that his ability to communicate effectively with the public could help bridge the gap between the government and the people it serves. So, what's next? Dr. Oz will need to be confirmed by the Senate, and you can bet there will be plenty of debates and discussions during that process. Whether you're a fan of Dr. Oz or a skeptic, this nomination is sure to be a hot topic in the coming weeks. All right, folks, that's the scoop on Dr. Oz's new role in Trump's administration. What do you think? Is Dr. Oz the right choice for heading to CMS? Drop your thoughts in the comments below. And don't forget to hit that like button and subscribe for more updates on this developing story and other news. Thanks for watching. I'll catch you in the next one.